Have you been told that you have a herniated disc either in your back or your neck? Maybe you got an MRI and it showed that you do have a bulge or a herniation, and now you're wondering, is this thing ever gonna heal, or does it automatically mean I need to go talk to a surgeon? Now the good news is that many herniated discs do improve over time and many people recover without surgery, but there's an important difference between your disc healing and the symptoms or your functions improving. We're gonna talk about that today. I'm Dr. Garst with the Well Chiropractic Clinic here in Mesa and Gilbert, Arizona. And in this video, I wanna explain what a herniation actually is, whether it can heal, what to do, and what to give your body the best chances of recovering are. So first, let's understand what a herniated disc actually is. Now, between each vertebrae is a little disc that acts like a shock absorber. It has a tough outer layer and a soft inner gel-like center. Now, herniation occurs when this outer layer weakens or tears, and that allows some of the inner material to push through. Think like a jelly donut. Now, if you squeeze the donut and that jelly kind of pops out, that would be the medical equivalent of a herniation. Now, the important part, if that material presses on a nearby nerve, which sit right on the back side, that can cause the pain, the shooting, the stabbing, the numbness, the tingling, the muscle weakness. Now, interestingly, not every herniation causes pain. Some people have confirmed that they have a herniation or a disc bulge on an MRI, but they don't really have too many symptoms. So the one question we get a lot in our office, because we treat herniations all the time, is can this thing heal? And the answer is yes, many can, but not always in the way that people think. Let's talk about anatomy here for a second, or your body's physiology. Your body has an incredible ability to heal, reduce inflammation, and gradually break down some of that herniated disc material that we were talking about, like the jelly in our donut analogy. Now, over time, that herniation may shrink, which will reduce pressure on that nerve, allowing your symptoms to improve, which is obviously a good thing. Now, in many cases, people experience significant relief over several weeks or months as the natural healing process occurs. However, the disc may not return completely to as it was before the injury and look what we'd call normal on an MRI. That's why it's more important for us to focus on your function than just what the imaging shows, okay? Now, although your body does a lot of this healing process naturally, there can be several things that will drastically improve, enhance, or speed up your recovery. Now, we almost always promote staying active. One of the biggest things we get is, should I just sit on the couch, take it easy? No, we wanna make sure that you are moving. Movement is better than prolonged rest, and knowing the appropriate activities or exercises or movement patterns is gonna be key. Things like improving your posture, avoiding repetitive motions, things that can aggravate your symptoms over time. Strengthening muscles that support your spine can also help reduce the stress on that disc and take the pressure off that nerve. What we focus on, conservative treatments, chiropractic care specifically, and other non-surgical approaches can help reduce that pain, take the pressure off that nerve, and get your nervous system getting back to its normal ability to function and move. Now, keep in mind that not every herniated disc is going to respond the same way. Treatment plans depend on the size, location, herniation symptoms, and your overall health, and that's how we're going to give you good recommendations. Now, while most herniations can be managed conservatively, some do require some medical attention. So let's talk about some of those things briefly. If you develop severe leg weakness, both sides or single, lose control of your bowel or bladder, experience numbness around your groin or your saddle area, emergency care could be appropriate. We can guide you on those kind of things. Now, those are extremely uncommon, but they can indicate a more serious herniation that might require a more urgent evaluation. Now, the bottom line, a herniated disc does not automatically mean surgery. Many people do improve with time, and with appropriate conservative care, we can get you back to doing your normal activities without a ton of pain. So if you've been diagnosed with a herniated disc and you're unsure about your next steps, getting a thorough evaluation can be an awesome way to determine what's causing your symptoms, what treatment options are going to be the most appropriate and most effective for you. And so take advantage of that. If you found this video helpful, give it a thumbs up, like, and subscribe for more spine and health tips. Leave your questions in the comments. We love discs in our office. We treat a lot of them. So I just want to thank you for watching, and I'll see you guys on the next video. Have a great day.